Hello everyone, welcome to your lecture on evaluation, and this is the final step in the nursing process. These are the learning objectives that we will be covering in this lecture. What is evaluation? Like we mentioned before, evaluation is the crucial final step of the nursing process that determines whether a patient's condition or well-being improved after your nursing interventions were delivered. It's a planned, ongoing, systematic activity in which you make judgments about the client's progress. These were your outcomes. Did the client achieve those health outcomes? The effectiveness of the nursing care plan. Did your nursing care plan work? All that hard work you put into it, did it work? Right? The quality of nursing care in the healthcare setting. Evaluation and assessment both involve data collection, but there's a difference in when you collect the data. Both require data collection. The difference is when. Assessment data is collected before the interventions are performed, because remember, that's the first stage of the nursing process. You're collecting data, assessment data, you're collecting subjective, objective data, your physical assessment, the health history, all that information. So you haven't performed your nursing interventions yet. You're just in the assessment phase. Now, data collection for evaluation is done after you've implemented your interventions. After you've done all that, you planned your nursing, you came up with your nursing diagnostic statements, you planned your outcomes, your interventions, then you implemented those interventions. Now you're going to collect data to see whether your interventions worked or not, whether your patient, achieved those outcomes or not. So, what does the evaluation process involve? It involves examining the results. Use evaluative measures that are reliable. For example, if it's pain, the patient was in pain, you administered pain medication, was your intervention, then how will you evaluate it? Don't just say, oh, well, he's watching TV, so I guess he's not in pain. That's not how you evaluate that, right? So you're going to evaluate it using a reliable pain scale. Okay, you go back to the patient and you reassess the patient and you say, hey, it's been an hour, 2 hours since the medication was taken. How would you rate your pain now? So if the patient says, oh, my pain is a 2, and before it was a 7, so you know that it worked, right? So that's how you evaluate. Nursing outcome classifications. Use the nursing outcomes classification systems where they give you the evaluative measures on how you can evaluate it, right? So for example, if the patient had low oxygen saturation and your intervention was, per the physician's orders, you're going to put the supplemental oxygen on the patient. Then you look back and how do you know that it worked? The oxygen saturation went up. It has to be data that is measurable and reliable. Compare achieved effects with the outcomes. So if you had planned, okay, the patient's pain will go from a 7 to a 3 or below 3, and go there and reassess the patient. So is the patient's pain 3 or below? If yes, then compare it to your outcome. Oh, my outcome was that the patient will have pain less than 3, and the patient said it's a 2, so they both matched. All right. Interpret the results and summarize the findings. So you want to summarize those findings and interpret the results of your outcomes. Recognizing errors and unmet outcomes. If you notice as you're evaluating your outcomes, there was an error, or there was a mistake somewhere, or there was an outcome that wasn't met, recognize that. Don't be ashamed to recognize it. Because the nursing process is a repetitive, continuous cycle, and you just have to kind of do the whole cycle all over again. So we are human beings, we make mistakes, but the thing is, you're doing it because you want to provide safe, effective care to the patient. So recognizing it and acknowledging it and restarting it, that's what we do, right? So correct those errors, revise the care plan, and then discontinue it once it's completed. Examining results is an ongoing process. You're comparing before and after interventions. It's a continuous process. Reflect on the patient's condition, the treatments, and the resources. It requires assessment skills and techniques that we mentioned, and it requires clinical decision making. It look for trends to determine patterns. What are the trends? Is the patient showing improvement? Is the patient deteriorating? Recognize those trends and patterns, right? Recognize improvement or deterioration. All of these are very important as nurses. Evaluative measures. Remember, we mentioned that when you're evaluating an outcome or an intervention, you want to make sure that you use proper, reliable, valid measurement tools. For example, the pain scale for pain. Always use, evaluative measures are made after nursing interventions to make clinical decisions about the patient's progress, right? Recognizing patterns. Use appropriate and valid evaluative measures, such as reliable scales, not scares, sorry. An example like pain scales to evaluate pain. Behavioral evaluation. How would you evaluate an outcome that was behavior-based? Okay, for example, the patient will have less anxiety. How could you do that? Or the patient will have, show less signs of depression, right, or grief. How do you do that? You can survey them and interview them to evaluate their ability and to perform self-management. It's very important for patients and families to learn self-management because that's what's going to improve their quality of life. It minimizes the impact of chronic disease, acute illness, functioning, psychological effects of illness. So if the patient and patient's family is able to self-manage their disease process, it makes it easier on them. It improves their quality of life. The nursing outcome classification evaluation indicators, you can evaluate those with, they have Likert type scales. For example, ratings from 0 to 5, 5 being the best, 0 being no. So they have scales like that you can quantify your evaluation. Then compare those effects, the actual effects on the patient with the outcomes that you had set to measure the effectiveness. These are some examples here. For example, if your evaluation indicator was you want to evaluate self-management of the patient. So the evaluation indicator is self-efficacy, right? So examples of measure is a self-efficacy scale, right? Which, is available with that evaluation indicator. Interpret and summarize the findings to measure whether the patient's status is improving. What are the steps? Examine the outcome criteria to identify the exact desired patient behavior response. Evaluate a patient's actual behavior or response. Then compare both of them. So what was your outcome? And what are you seeing in the patient? Compare both of those. Then judge the degree of agreement between the two. For example, if your outcome was that the patient will have pain less than 3, and you asked the patient and they said the pain was 2 out of 10. So what is the degree of difference between those two? It's great, right? You measured less than 3 and you met it. It's right on spot. If there's no agreement, say the patient says my pain is at 5. Now there's no agreement between those two. You said you wanted it to be less than 3. The patient is saying it's 5. So then there's no agreement. Then what would you do in that case, right? Then you're going to reflect on it. It's like, why didn't their pain level go down? Okay, what is going to be your next action? Your next action will have to be revising that plan of care. Okay, this intervention didn't work. This nursing diagnosis was not appropriate. So I need to change my nursing diagnosis, change my interventions, and redo that process again. Here are some examples over here of objective evaluation of outcome achievement. For example, outcome. Patient demonstrates correct hand hygiene by 12:16. So let's see, what is the patient's response? Your outcome was that they will demonstrate correct hand hygiene by 12:16. Now let's see what the actual patient's response was, right? The actual patient's response was patient used antiseptic hand rub to correctly wash hands on 12/16. So was your outcome met? Yes, it was met. They demonstrated how to, use hand hygiene by 12/16, how to perform hand hygiene by 12/16. So that was met. So this is how you evaluate whether your outcomes were met or not. Recognizing and correcting errors and discontinuing the care plan. Recognizing errors and unmet outcomes. After you determine that your patient met the expected outcome, confirm your evaluation with the patient when possible. If you and the patient agree, then you can discontinue the care plan. But what if your outcome wasn't met, right? Then reflect on and observe ineffective outcomes. Adjust them, correct those errors, revise the care plan, complete the entire nursing process sequence again, and then check to see was it met. And if it was met, then you talk to the patient, you both agree that the outcome was met, and you discontinue the care plan. Documenting the outcomes. Documentation and reporting are important parts of evaluation because you have to share that information with the other members of the healthcare team so they know what's going on. Accurate information needs to be in the patient's medical record and shared in your SBARs, your handoff, your ongoing communication, so other nurses and team members know what's going on with the patient so they can make proper clinical decisions as well. So we're all done with the nursing process, and please go ahead and you have your guided notes. You can, refer to those. If you have any questions, I will see you in class.